workbook today and let everybody give a little input so we can kind of
Well,
start flowing. Would that be
that's why
okay?
you need to open my email, Miss Branch, because I
Okay.
took the work plan, the sustainability, and utilized
Uh-huh.
the framework for the sustainability and the hypothesis.
Okay.
I created two hypotheses and sustainability based upon the conversation we had and the task that I was supposed to bring back around data and civic engagement. Because
Okay, can you
remember,
go over that today? Can you go? Are you
yeah,
ready to do it today, or do you
yes,
want
that
me to
if
look
you
at it
pull up that,
first?
it's only 9 slides.
I have it. Do you want me to look at
Yeah,
it,
yeah.
or
So
can
when
you
we
go
start
over
the
it
meeting,
today?
yeah, yeah. When we
Okay.
start the meeting, we'll and then you can put up that the what's her name's that
The
work plan.
workbook, yeah,
Yeah,
the
yeah. Thank
workbook.
you. I couldn't get it together.
Yeah.
Yeah, because it's three categories. It's called a three categories in that workbook. But let's just save it. The PowerPoint will speak for itself. It's really about just a proposal and then a discussion, and then we just we keep moving it forward.
Mm-hmm.
Okay. All righty,
Okay.
ma'am. So I'm
Got
gonna go
you.
on mute until we get started, and I'll be off camera because as you can see, what time I sent it to you. So I don't have I didn't beat my face this morning, so I don't want to scare folks away.
We appreciate you, Miss Carrie. We do. It's interesting we were on the same wavelength that I didn't see, so that's good. The angels were working while I was sleeping.
Well, what it is you remember the rhythm and flow. We're right where we're supposed to be. And when we're right where we're supposed to be, we always remain in sync.
How about that?
How about that?
How about that?
That's
Okay.
the collective power.
Collective power, collective action. Mm.
All right.
Well,
That's it.
we have some good updates, folks. So, is there anybody here from the committee that wants to kind of dive in first before we kind of start checking all the boxes? Mostly checking back with Brenda and Michael when he gets here about his report to make sure we connect the Black Women Rally with our distribution plan and needs and the data that we were talking about, trying to figure out how we can collect and expand. So, okay, if there's no further comments, I'm gonna just get right to it. Miss Carrie. So, we have a few things coming up Monday. I just want to remind everyone, if you can, attend and register for the sustainability session with Kachi. I'm going to drop it in the chat and maybe I'll put it up on the screen. So if you can take a screenshot sometimes, that might be easier. But I put it in the chat. You can register for the Zoom there as well. If you forget, just reach out Monday morning. And there we will be discussing this sustainability activity and kind of getting into the nuts and bolts, which we've been talking about too. So just that's the biggest reminder. And then the April regional meeting is set. They're only having 3 people attend, so it'll be the same 3 people, Shaw, Alberta, and Michael. That's their rule. That's what they asked for. And so we'll see what's going to be happening. And as many of us that can participate in the planning, let's do that. But they're going to be talking about sustainability and what are our sustainability steps, our plan. Ms. Carrie's going to go into the details, putting together a budget, like all these committees and roles and responsibilities, activities we want done. We need to put a number on it, a title, and put that in our sustainability plan. And then we start shopping the plan in the spring. Quarter 1, we finish. Quarter 2, quarter 3, we start shopping our plan. So we're very close working our wellness fund. So Miss Carrie, do you mind if I put these slides up? Would you walk us through?
Good morning, how are you?
I thought we were going to hear from Brenda regarding the follow-up. So just
Okay, I'm sorry.
so we can
Go
have that
ahead.
kind of continuity from last meeting to this meeting. And then we'll go
Yes,
into the
yes.
slides, ma'am. Okay.
Okay. Miss Brenda, are you ready to give any feedback today or no?
Well, yes, Connor and Andrea and I met. We've made corrections based on the feedback of this group, and that follow-up survey is going to go out. The thing that we did with the zip codes is we looked at and we gathered the health districts, and so we gave people options because there's within the area there's health districts that have a variety of zip codes attached to them. So basically what we did is we gave them a chance that they could choose one of those health districts that by looking up their zip code, so it would go fairly quickly. And then we left an option if they wanted to fill in a zip code. And we also left an option at the end that they could register if they wanted to go into a raffle for a prize. We're thinking we would give them a little something like maybe a gift card and just do it like we did a little bit like we
I
did
love it. We can maybe give them $50 this time and give a bigger one.
That's what I was thinking of. At this point, we'll just do one and we're going to give them 2 weeks to do it. And so we can report back in a couple of weeks. Connor's going to work on it and get it out this week. So that's our story. We're sticking to it. That's it. Hello?
Sorry about that. I might think my mic was off. No,
Okay.
that's great. I think that's a great update. This is truly amazing. So we'll have survey one, and then we'll have the follow-up survey, and then we'll report on both, like community update or something like that, community highlight. I don't know if we'll call it, would it be an impact report, or will we be able to use that to guide our sustainability plan?
Yes, it will. And I think we focused on the goal of that survey to really be able to inform our health plan partners on at least one key area that it came up out of that survey that they needed to look at. And so in the follow-up, we tried to get just a little more detail so that they can see, hey, this is a problem area. And then we can meet with them if we want and say, well, what are you going to do about it? And how can we help?
Okay, I love that. So do we have any numbers on just we took in approximately 200 surveys that we're looking at, or I don't ever remember us saying how many we took in from the first round.
It was about 350.
Okay, got it. I just want to have a little numbers that help us.
Yeah.
And
the
then
follow-up
about
survey,
350.
the follow-up survey is the ones who gave us their email addresses, and that was 119.
Okay. That's great numbers for
And we
a
also
community.
we also talked about doing the survey and maybe the follow-up survey, one or both, with our own membership, because we have our own lists. So if we wanted to do that with our membership, where like the group that the email goes out to, for example, we could do that as well. So that's something we'll discuss.
I like that idea too. That's a good one. But the numbers are
it's substantial.
Great.
It's substantial.
Yeah, that is. It's enough to really be taken seriously.
Right.
Mercy me. Okay, go USC. Dr. Brenda. Dr. Brenda, we still have that, what was it, the award or something that some official gave us. We have to get that original to you because it's not copying well. So you
Oh,
gotta
the
remember, I
one,
think Candy was just telling me about it. Yeah, reminded me that it's still in the office in my box.
oh, okay, I would like it because I haven't ever showed it to our Rotary Club yet.
Okay, I'll get it to you. We'll offline. We'll make arrangements for me to do that. Either
Okay.
I can mail it, FedEx it, or we'll have to meet up.
Yeah, I'd love to meet up.
Okay, so let's figure. I would love to meet up too.
We're scheduling lunch right in the meeting.
Exactly. I would love that.
I'll follow
This
up
is
with
great. Congratulations to the data team. Amazing. In the middle of preparing the impact report, we also completed, a public survey. Very well done, Dr. Brenda. Very well done. I hope UST, do we get some bragging rights? Will I be able to go to a meeting with them and brag about you? You gotta find a meeting for me to come and be your wing woman and brag about you in front of your
Okay.
colleagues. Okay.
We'll figure that out.
We'll
Actually,
figure that out.
I have an idea, so I'll talk to you about it later.
Okay, awesome. Michael is here now. Miss Carrie, do you mind if we give Michael a
Yes,
few?
yes, let Michael, yeah, go ahead, dear, go ahead.
Hello.
Michael, can you give us an update on your report, please?
Sure. So our wonderful intern was able to update the data. I think I sent it out to everyone, the link that you can take a look at it. Maybe I should open it so I can demonstrate what we have here. Let's see.
Hey, Mike, when I got that link, it took me to Danger Man instead of your,
Oh gosh.
and I
Okay.
don't know if it was just something in my computer or whatever, but I never got
No,
to.
the Dr. Brenda, it happened to me as well.
Oh,
Oh, okay.
maybe it got
Okay.
Yeah.
crossed.
Yikes. Okay. It just happened to me. Okay. Sorry about that. Let me find that link.
Were you sending us a subliminal message, Michael?
Right, right, right. Let's see. Okay. See. One, two. Okay, there we go. Let's see. Just refresh that. Make sure it's the right link. It says it is. Does that say presentation? Straight ahead, danger man. Okay, I don't know where I got that from. Okay. Let's see. I'm going to put it in the link in this chat. Then I'll share from this computer. If I can get sharing rights, that'll be great. But we were able to work through a couple kinks. We narrowed it down to only Black women because the other populations were statistically insignificant, and so it wouldn't make sense to add if there was just one person here, one male there, and another race here. So we narrowed it down to just Black women. Cheryl, can I get sharing rights? Or Ken?
You already have them.
Okay. Why is it starting sharing screen will stop other participants' computer sound share?
Up, I'm still sharing. That's why. I bet.
Oh, okay. Okay. So I'll just go through a few of the slides, just so you get a sense of what we did here. Intern, absolutely stellar work. We're very pleased with the outcome. Okay, where'd it go? Okay, about the survey. Okay, there. And so the survey was conducted in 2024, August, at the Black Family Reunion from the National Council of Negro Women, then on Taste of Soul. And there's a copy of the survey there. We're also going to make sure that we cite our intern so that this is something that she can add to her portfolio. And so these were the data that were admitted. Set 2 males, and then no responses, and then you can see the race and ethnicity. A couple people didn't put their age, so that was about 17 surveys that we excluded. So 222 was the final number. And really good, rich data. And again, this is just a point in time. Who knows now, after the new administration is in place, what folks would answer or respond to the very same questions. Probably mental health will go up a little higher. Who knows? But mental health seemed to be a major issue. We thought that was very interesting. We know that we've been hearing about mental health issues and folks dealing with mental health, but to have it by the numbers was really interesting. And then high quality healthcare that is culturally authentic. And so I think we all understand what that really means. And then elderly care, but there were a lot of seniors who participated in the survey. Most important issue, social concern facing the community, lack of economic security. And we can all relate to that. And obviously here in LA County, affordable housing is an issue, and racism. We heard a lot about that yesterday, and it certainly persists across all areas of life here in Los Angeles. Most trusted sources of information about healthcare, medical professionals, Department of Public Health, and health insurance companies. It was interesting also to see family and friends and news sources coming up very close to the top as well. We know that a part of our culture is talking to other family members about, I got this hurting or that hurting, and what do you think? Should blah, blah, blah. And so I can certainly relate to the family and friends being a source of health information, even if it's inaccurate. Family and friends has become a trusted source for us. And so that may have implications on how we reach out to our people to get information into our folks' hands. And then the final question, do you now trust the LA County Health Department more than you did before COVID? Majority said yes, which is a good thing. Who knows, after the fires in Altadena and that alert didn't go out to the folks in the Black side of Altadena and this and the other, what folks would answer now. And that was a part of the county that occurred in incorporated part of the county. But very interesting that the majority said yes, and 35% said no. And the big piece around that is, let's look at that one by age. And all this is broken down now by age of the women and by the question. So you get a good sense of what age groups we're talking about so that we can further target whatever messages we're going to be targeting. Let's see. Okay, the trust in the health department. So our seniors, 53% rated it the highest. And that showed in our vaccination data that our seniors were more likely than any other population to be vaccinated and to get the boosters. And so we learned that early on in collecting data, working with CRSSLA and our partners in the surveys that we conducted yearly, and found out that seniors were receptive to those messages about boosters and protecting their lives. And so it makes sense that that is the highest population that trusts now the public health department more than they did. And then 51 to 65, which is another older population. But look at our younger folks. Absolutely not. Well, you know, the 30 to 50 age group, 32 is higher than 30, but it's still very low compared to the other populations. And when we held focus groups during the pandemic, we learned that. And it's, you know, it'd be interesting to see how men answer this question, but most of our men were flat out no about trusting anything that the public health department had to say about their health. And that may be based upon history of some of the experimentation on Black men. But very interesting that the 18 to 35-year-olds absolutely do not trust the county more than they did before the pandemic. So we have some really good data broken down and disaggregated into some populations for Black women and exciting data. And one of the questions that we talked about yesterday or earlier this week with the intern was, you know, I know that we want to release the data, and we can talk about how we do that in a press conference, and hopefully we can get the supervisor to participate in this, because I think the big takeaway, not only what they rated the highest as far as their concerns, but the trust in the county, especially in the wake of the fires. We're going to need to maintain that so that we can get messages and get now that there's new data out now about infant mortality, and it's gone up with Black women. I'm not sure about in LA County. I'm hoping that it's getting better because of all the efforts, but across the country, it's shown that the gap has widened over the last year. And so we're going to need to trust the health department more and more. And so we can talk about doing a press conference and some type of press release. The question was, do we want to combine that with the data that you collected over the holiday? And I think that's no, because we don't want to step on that message. And I think that whole campaign there is another campaign that we can tap into to get more press and more information out about health. So my vote on that is that we do them separately so that we don't step on messages and we can continue to be in the face of our people about these types of issues. I can open it up to questions.
What a great report, Michael. Thank you. I agree. Okay, we're flexible. I think you make a good point. Keep each message separate, but we still can report. When we go in April, we're going to report we completed 2 surveys with the public. So we're going to talk about both. We can talk about at the community level and at the organization, at the network. The ACH level is Dr. Brenda's key area doing our impact report since we started. Amazing. Melina, another fine intern coming out of the USC network. Amazing talent. Thank you. Anything else? Anybody else have any questions? I love it.
So we'll clean this up and get out a final of this material, and then think about if we want to do something by the end of Black History Month to release this data. I know that we talked about that because it is Black History Month, that we can use that as a something to get attention, or if we want to plan it for another time. And so Black Women Rally is open to that. We're going to have another meeting next week, but we're open to doing it in the end of the month.
You know what? It might sound slight, but it is so appealing to the eye. It is so nice to look at, and it falls right. It's easy to grasp and pick up. The colors are nice, and it really draws you to what it's saying. I like this, Mike. This is nice.
Yes,
Yeah.
I told the very same thing to our intern, and I agree with you 100%. Very easy to read.
Yeah. Congratulations, you guys.
Yeah, Yeah, very, very powerful coming out of the CRSSLA partnership. It's amazing data work of Black women rallying for action. So glad to have you a part of the team, Michael, and the women that you support. It's amazing. Couldn't get any better.
Yeah,
Okay, well, we have a lot to.
all set. Stop sharing. Okay. Girl, did we lose you?
Yeah, just cut her off.
Dr. Wewell, if you can work with Melina and help with how we can cite her in this report, that would be great. And anything else having to do with the university that we should add to the final report.
Okay, I'll talk to her about it and look into it. I think we might just want to do it similarly to what we do with the outcome studies, which is we put the name, we put MPH, and then we put, I think, intern from in the school.
Yep, definitely want the school there. So perfect. So yeah, if you can work with her to send that to me,
I'll
that
get
would be great. Thank you.
So this is the sustainability workbook. It's a Google document. So anyone who wants it, we can share. You get your value proposition. So this is one of the reasons. Good job, Ms. Carey, for pushing us to develop that value statement. Remember, we had just mission, vision, and then we were once again in sync, right where we were supposed to be. And then the second tab is where we enter our resource needs. So this is where we can put our budget. And we want to take all the different roles that we've identified and make sure that they're funded, right? And then there's still going to be some in-kind, and that's why we're going to huddle up. If we can get a couple of meetings to just huddle up the data team to look at how do we begin to capture and document those services. What are the things that need to go in for us to end up with that outcome, that we can improve our reporting on the in-kind, because a lot of in-kind happens. And the foundations gave us a clue and already told us that's your money slide. So that's what so we're going to try to marry those two things into a strategy now and put that on the table for Kachi to see. We have a clear strategy highlighting the fact that we are community participation heavy, but as compared to our colleagues in the 37, we have more community leaders, and then we have a strong data infrastructure, reporting infrastructure. That's going to really set us apart going in with these MCPs. Because by comparison, all the other typical 37, they're working with professionals at the table. And it's so we really get to highlight that with these two reports coming out. And then you get your last. So these resources, it's a good time for us to talk about our value. What is that value? How do we monetize it? And for the intern, this is how we learn how to translate our intellectual capital and our skills, into positive income, right? Because two got to go together. So we got to make peace with that. Some of us have big trauma when it comes to talking about money, so we'll get to that too. But this is our funding hypothesis. So Ms. Carey took some time to think this through and then can guide us into more conversations, contracts, healthcare reinvestment, local government funding. And we're going to try for all of these. as much as I think we can go for is we need a diverse, and diversity means as many streams of revenue as possible, because the cost of doing business really is tough. And I want to highlight that we want our community to only have one job. Why we got to have 7? That is not a practice we want to continue. So I want to put that on the table too, that we're moving our work in a direction to capture and solve some of those problems. If we're in business, we need to be able to pay our people, and we need to pay them enough where they can focus on one thing. And if we could change that culture, what a powerful statement. So it may not be big. You may not have 500 people, because it takes a lot to fund that. It may be 5 good people on a team. 10, these smaller numbers. So this is where we're going next, into the Wild Wild West. Ms. Carrie, I know you did some thinking and talking on this. So did you want to add anything? These are the core sustainability questions that Kachi wants us focused on. What is the value of our ACH work? So that's the same. What is the value of CRSSLA in the community? Who is likely to pay you to produce that value? And what resources do you need to continue your ACH work? What funding hypothesis makes sense? So each of you, think of this as you're taking this, you're participating in these activities for your organization's benefit as well. So this is an authentic double bottom line. We get a win-win here, because as we answer this as a network, you can duplicate that step within your own organization and begin to reflect. And that's good capacity building. Right? And so we're providing the tools, we're just sharing them openly, and I'm pointing that out. So we're going to report and do as much tracking on that as we can, and not as, but so let's start the conversation. What do you all think is the value? Go ahead, Ms.
Ms. Branch, so at this point, now that you shared that, can we go into the 9 slides? So people, and then what we're going to do is we're going to make sure that the link goes out for these, the catchy, sustainable workbook file, right? Because we want them to apply this to their agencies, to their organizations, to their coalitions, even to their community, right? Because we want to collect as much information to finalize a way in which we can sustain the movement of CRSSLA ACH. So if you can put the slides up, and I will go through my approach to utilizing the workbook to stay in line with what CRSSLA's ACH work plan calls for, what the catchy overall initiative is about, and the deep conversation we had on January the 30th around data collection, data sharing, data management. And so this is just a thought process of me trying to apply and stick within the framework and the structure that was provided for us. So starting out, once again, reinforcing CRSSLA's ACH mission and vision statement. This is all part of creating that sustainable organization. Next slide. And then a value statement. This is so important because this value statement incorporated the intent of your mission and your vision statement, as well as the intent and the mission and the vision statement of the CACHI. CACHI talked about transformation. It talked about transactional program. It talked about creating programs that do not fit the needs of the population that it serves. So next slide. So we have, the CRSSLA has already identified the value, right? So when you look at the sustainability worksheet, and it talks about sustainability, it talks about the value proposition. That was your, that's CRSSLA's value proposition, is your value statement. Now, there are two areas, more like three areas that CACHI planning body and coaches and the powers that be, leadership, is putting on the table for the webinar or for the April convening. And that was around data, civic engagement, and sustainability. So let's start with data. Once again, combating alternative facts with facts, because the truth does not expire. And the reason why I'm saying that is because we're in a world now of alternative facts. And alternative facts is based upon, if you create enough lies and propaganda, you create discourse and disconnection, and then you diminish democracy. You diminish the process of people having voices. Next slide. So to combat that alternative fact, here's an hypothesis that incorporating a population-based approach assessment tool. Now, there are many assessments tools that CRSSLA's already undertaken. Ethnographic observations, key informant interviews, surveys. You all have we just spent the last 45 minutes in the last 2 or 3 meetings talking about what data and management and sharing of data. What we've also talked about is that the managed care plans don't share their data about the million of patients that they're providing service for. So one of the hypotheses that we need to incorporate a population-based approach to collecting data. And the reason being, if we want to transform a system, we must be able to gather information not at every level, from the population within a community, assessing the system that affects that health of that population, assessing the individual, the family, and assessing where people live, work, and study within certain neighborhoods. Next slide. So how do we sustain that? Well, we have to embed a geographic information system or a similar software system into a minimum of 3 to 5 community-based organizations. Because what did we talk about last week? The difficulty of service providers providing service, not really there to collect data and analyze data and store data and disseminate data, right? So CRSSLA ACH provides that capacity for the network as we continue to move forward in transformation. And then also helping to identify best practice. These are just some of the sustainability that can come out of this hypothesis. Next slide. The second hypothesis is around civic engagement, that those who participate in the process greatly benefit from the outcome. And the fires help us to understand that everyone is going through some type of traumatic pressure. And so as people move through that pressure, as people move through that trauma, how do we help them gain a sense of being not only just a consumer, but an informed constituent to a publicly skilled collective policy making critical thinking civic engagement leader. A lot of words there. But the bottom line is those who participate in the process greatly benefit from the outcome. And this helps to counter alternative facts. This helps to encounter the dismantling of our democratic system. And then it helps to engage members of a diverse stakeholders in a collective action, maximizing all of our community assets, from in-kind to foundations to USC, to Charles Drew, to Black Women for Wellness, and et cetera, and on and on. Next slide. Sustainability, because this is going to help us monitor those managed care plans, because they have a mandate to engage and bring in consumers, right? And it also helps us to mobilize and raise awareness around participatory budgeting and seeding California. This is an initiative that's going to cover the state of California. And mind you, it is also being funded by the same foundation that is part of the private-public partnership for the CACHI ACH. So tying it all together, part of the transformation is around data sharing and civic engagement, community engagement. Next slide. Where I draw my reference in bringing this picture together is the concept paper on strengthening the Medi-Cal community collaboration through a reimagined population need assessment. If you look at that document, it spells out everything that we have began to talk about in terms of engaging community, raising the voice of constituents, empowering consumers, making sure that the health system no longer serves as a detriment to Black people and people of color. And then second is the benefits of using a geographic information system. It's a study on how utilizing the geographic system software using the university and community-based organizations that you strengthen data management. And then lastly, there is a community assessment tool that helps us to understand the difference between transactional activities and foundational activities that improved and empowers and improves the overall wellness of a community and helps to address the long-going traumatic experiences that people face. And that's it. I'll open up for question and discussion.
Well, drop the mic, Miss Carey. You put a lot of thought in that, and that was so succinct. I'm sharing that. The first time I'm going to say you did it, and then after that, I'm going to take credit for it.
Well, that's the whole point of a collective thought. It's through our collective thought, and it's through our collective vision and principles that we all share in this. That's why everybody, once we go through this, you're the owners of this. Based upon the conversations that we had, listening to what was being talked about, taking my notes, and then taking all of those notes, taking all the reference material, taking your work plan, taking the original CRSSLA objective, number 6,
Right.
to address traumatic pressures, right? And just beginning to continue to tie that together. That's my job, right? So
we really appreciate that.
Questions, comments. I want to ask a question. How do you propose to use this within your organizations, within your networks?
Well, we're going to use it as how we are going to keep the CRSSLA and the ACH going, like from where we started, from crisis to now creating this Black health equity, using the workbook they gave us to fill in the numbers, fill in the roles. And you just made the case, like you just gave us all our homework. We're going to use these. These can all be made into SMART goals. And it just works. And who can
Miss Branch, I'm sorry, I forgot one thing. The reason why I'm emphasizing data collection and civic engagement is because, once again, that's what CRSSLA has been about. But when you look at the CalAIM initiative, that the goal of that initiative is a transformation, including payments for community support, such as housing support and medically tailored meals, as well as funding to maintain, build, and scale service capacity and infrastructure needed to support community-level service delivery networks. Particular attention is focused on communities that have been historically under-resourced.
Yes, that's
Among
it.
other entities, CBOs and ACH can qualify for such funding through several different models that will be discussed throughout the session. And that's why they're focusing on, guess what? Data management and civic engagement. They're trying to help us to develop the template and the structure to be competitive for those dollars. So it's time to do homework. I did mine.
Well, we have all the parts. We're so close. And that's from the CAL-AIM. That's the Enhanced Care Management. Now, what I'm hearing from some of the providers, I spoke to two African-American Beat the Black Doctor folks, the professional and a medical doctor, and they are being denied. They're being told, they heard back from LA Care, for example, that we're, like, we have enough, we're not going to take you. So I said, well, look, we need to talk because the health plans should be accepting all qualified providers. That should be their mantra. And that's where we're going to try to influence them, is in this window. You should be accepting all providers. Let the consumer, let the patients choose. So if we do all this work and we can't get, quote unquote, our providers in the system, that's the problem. So I just want to throw that in the mix as well for the thinking, Ms. Carey. That's what I've heard so far. Blue Shield said the same thing. So the big health plans, this is where we got to get that breakthrough. So hopefully some of our data that we have from the public survey and Black Women Rally can be used in these upcoming meetings with the managed care plans, which we said we wanted to start having our first meetings like March, April.
Well, make no mistake, Ms. Branch, make no mistake. When we look at the value proposition and when we look at the funding needs on our workbook, we're definitely going to put every one of those managed care plans, and we will be asking for a certain amount of money to improve the Black doctors, improve access to physicians that look like me, walk like me, talk like me. That's part of the goal. And we're going to use that data about lack of access, waiting time, can't get a appointment, et cetera, to leverage that to get the money needed for the network, including our physicians.
Correct. So that's some real time challenges that have been shared, because we were all excited about them going and starting to apply. Andrea set that up through the FQHCs. So, there's just some unconscious bias going on, and we got to find a professional way and use the data to share that and push back on that for these medical physicians and other health professionals that are being kept out of the billing system and the opportunity to bill. We want to participate in that.
So, I'm sorry, my brain started racing, so I don't want to forget. Can you send me something related to that? Because this relates to the FQHCs, and understanding the FQHCs were fundamentally created to service the community that has historically been underserved by the large hospital medical system. So they're in the same boat as a community-based organization is.
In a lot of ways, and this is where we have to take a close look. So I don't want to judge and I'm not making a value statement. I'm trying to report the facts. So at the same time, the FQHCs, however, it's the same group, you know, so the system, what's happening? How come we're not considering new groups and these other Black professionals and medical doctors who can't get in? That's the messaging, right? That's their issue. So even within the FQHC community, there's some things to take another look at. That's what I want to say, to be fair.
Brenda has her hand up, ma'am, just so we don't miss her, because it's now 9:57.
Yes, Ms. Brenda, you got the last word.
Okay, I just wanted to point out that one of the surveys, Michael's survey, focused on mental health. And I'm kind of curious about how accessible providers for mental health are within those systems. And if that's also something you might want to focus on a little bit.
I like that. Mental health services is a great way to come through that vein. I like it. We got a lot here, folks. Boy, when you guys get to work, you get to work. Jeez.
You know, Cheryl, another one to latch on to is that people are talking about wait times. So if they're not doing services more local to the people and putting more in the community, especially when they have dense populations. Yeah.
Okay. Thank you. Any other final thoughts? We're at our last two minutes.
I have a thought, just along what you all were just sharing about the health providers. Has CRSSLA considered working with or kind of like targeting the community benefit offices that work for these healthcare providers? Because their whole funding structure is supposed to be giving back to the community that they're a part of. And many of them, I think, don't really do a good job of using that funding for community needs. So that could be a potential group to think about.
I like that. Yes, I would love to do that. I have a few managed care plans I'd like to clap back on.
And you know what? And how we clap back on them is
I love it.
how we clap back on them. If you look at that CalAIM assessment, they are mandated to provide a report to the state. That's what I'm trying to find out now, is where is their report on their benefit and civic engagement, because they're mandated to report that to the state. And it should be there, but I haven't been able to locate it. So that's my next task.
I think if we look back in some of our data and our information, we had already started tapping into those benefit reports because we wanted to see what we were looking at them to see what they were saying that the community needs. Over like almost 2 years ago, we started using it. So maybe there's some reference that we can compare. If you said then you were doing this and today is today. Yeah.
Well, here's what I propose to do.
1 minute, 1 minute, 1 minute.
Here's what I propose to do, that I write up a concept and maybe we can get one of the students to help us to search for those documents. Would that be possible?
We can certainly ask.
Okay, so I'll write it up and then I'll send it to you and then we'll go from there. If not, I'll just keep searching until I find it. You know, I'm gonna find it, right?
Terry, make sure to send it to me. I have 1 new student starting and 2 new students starting, so.
I'll CC you. Okay, Doc, will do.
Yeah.
Will do.
I know the two that put them out is Cedars puts theirs out, and I think MLK was the other one that I saw. Yeah.
Well, we're going to pick a date.
Who else is doing? Yeah.
I'm going to come next week with some suggested dates. I'll reach out in between this weekly meeting, and so we can pick a date to get the MCPs in the room, which would include Cedars and MLK, and use our relationships and get them in the room. And these are the things we'll put together a nice, use Miss Carey's slide and make the case, get our ask very clear. And it's just step 1. We just want to get the conversation going. And I think that's what's gonna, if we construct that the right way, we want to be more inviting, because we're not gonna beat them up, but it's like let's have an accountability session, a real conversation, and a nice professional.
Let's reason together, huh?
Yeah, real white
Yeah.
people style. Sorry, Dr. Brenda, but we're gonna do a real white people style. We're gonna sit down with our wine and be very proper and cuss them. No, I'm just kidding.
As long as you don't sing for the show, we'll be fine.
I
Okay.
don't know how to do it that way, but that's what's going to be needed. If we can deliver the message, so we'll need some wordsmithing.
May I ask, is anybody having problems opening the document that Cheryl put up? You posted the assessment tool, right?
The
It will
community
not.
assessment tool, yes, that's the one.
Yeah,
that
it will
I'm
not
being
open. I've
prepared.
tried it 4 times.
I'll try to send it to you again. It opened up for me, so
It
let me
opened up
see.
for me too.
Okay.
Yeah, I just opened it again, so I'll try it again. I don't know what's
It
happening.
might be the rain playing with my computer. That's why I was asking.
I just opened it.
Okay, I'll just download it, the chat, and I'll try it later. Thank you very much.
All right, we're out of here. Thank you, everybody. Great
Okay, I have
content.
Cheryl, I have my hand up very quickly. I did put possible connections with LACHA and the health committee for the DVC. Don't know how we can work in it, but we're working basically on the same things. So some type of conversation. I'm going to speak to them about, I don't know what you want me to say to them. That's what I need to know. So I need that information if you want me to approach them with any way.
Can we talk offline on that one?
The Los Angeles Alliance on Community Health and Aging.
I see it. I was saying, can you and I talk, just may have a separate call so we can get this right for you. I can tell you how we can connect with them, how do we partner, all that.
Right.
Okay. Is that okay with you?
That's fine.
Okay, I'll call you.
Okay. No problem.
Today is a desk day. I have a couple of tasks I got to finish. Dr. Brenda, I'm going to finish those names today as well. I don't have
handle
to go
your business.
outside.
Handle your business.
Yeah.
Ms. Branch, will you make sure that you send out the slides, my slides out to the group so they can kind of utilize that as they go through the workbook?
Yes.
Once you send out the workbook as well?
I sure will. I'll do both. I said, I'm going to use it too. I'm going to use it for my participatory budgeting.
Well, that's why I wanted to make sure you got it. So as you prepare for that meeting this afternoon, is just continuing to build the momentum around CRSSLA, and you're being so modest, you haven't even shared with the group your presentation today.
Oh, for participatory budgeting, yes, and we hope we're going to have to pick some people to see if you have time to participate in the training.
And I'm hoping that some of the folks do sign up. I've already registered because my goal is, I could probably teach the class, but I can always learn something new, so I can bring it back to the network so we can just continue to build that momentum, right? Until we find another best practice, we're just going to keep moving forward with how we increase democracy in our community. That's right. I said it.
Got you.
And Scary, before we jumped off, I want to say this time frame is an opportunity for us to practice community, and especially as local Los Angeles, local Californias, and it's an opportunity for the health plans to step up to their, oath in terms of caring for their patients in the community.
Don't you know, because there's a Hippocratic oath to cause no harm.
Right.
And that's what we're using as our benchmark to stop the harm that is being caused by the health system. Ashe.